Okay, let's dive right into this explainer and uncover why a disease that's so often brushed off as a minor issue is actually a fast-moving medical emergency, especially for men over 50. Today, we're talking about bladder cancer. It's one of those conditions that doesn't really get the mainstream attention of other cancers, but as medical experts point out, its hidden nature is exactly what makes it incredibly dangerous if you don't know what to look for. So we're going to break down exactly how this disease operates, how insanely fast it can escalate, and most importantly, how understanding its mechanics can literally save your life.
Now, you might be wondering who is most at risk. Well, here is a truly staggering statistic: 50%. Half of all bladder cancer patients share one major, entirely preventable risk factor. They are smokers. According to urologist specialists, smoking is by far the biggest trigger for this disease. When you combine a history of smoking with being a male over the age of 50, the risk profile absolutely skyrockets. It's not just a minor correlation. It is a massive, glaring red flag that doctors look for right out of the gate.
And that brings us to a pretty terrifying question. What happens when you ignore painless blood in your urine? Because here's the chilling reality of bladder cancer. It usually doesn't hurt. We're going to explore the severe consequences of just brushing off this incredibly common, yet so easily dismissed early warning sign. You know, when something doesn't cause pain, human nature tells us to just ignore it, right? Maybe blame it on something we ate or just assume it's going to go away on its own. But in this case, ignoring it gives the disease the one thing it needs most, which is time.
Section 1. Recognizing the silent symptoms. Let's see how this hidden threat silently announces itself before it strikes. While painless red urine, which is clinically known as gross hematuria, is your classic red flag, bladder cancer can actually be a whole lot sneakier. Sometimes the tumors are flat and aggressive rather than forming a distinct, obvious lump. And these flat tumors might only cause frequent bathroom trips or this annoying lingering feeling of residual urine. This is incredibly dangerous. Why? Because a 50-something guy might easily mistake these exact symptoms for simple aging, or maybe just a benign enlarged prostate. They think, I'm just getting older, when in reality, it's a highly aggressive cancer sitting right there quietly in the bladder.
Section 2. How the cancer spreads. To understand why this cancer is so uniquely dangerous, we have to look at its terrifying anatomical progression from the inside out.
So, the absolutely crucial point here is that this cancer doesn't just form a neat little bump on the surface. Its progression starts in the urothelium, which is the innermost mucosal lining of the bladder. But it doesn't just stay there. It aggressively tunnels deeper. It invades the thick muscle layer of the bladder wall, and once it pushes through that muscle, it breaches the outside of the organ itself, eventually escaping into the surrounding lymph nodes and literally launching into distant organs like the liver and the bones.
In Japan, urology experts actually use a very specific clinical phrase to describe this behavior. They say the cancer is fast on its feet, or ashi ga hayai. They use this exact phrase to warn us about the shockingly rapid speed at which this specific cancer metastasizes if treatment is delayed even a little bit. 1 minute, it might just be touching the muscle, and before you know it, it's sprinted to entirely different parts of the body. And if it wins that race, the consequences are beyond devastating. If you wait too long and the cancer reaches those distant organs, the 5-year survival rate plummets to a dismal, highly lethal number below 5%. Less than 5%. It literally transforms from a highly treatable localized issue into a systemic, life-threatening crisis in just a shockingly short amount of time. And this brings us to a really fascinating, though scary, concept known as spatial multiplicity. Because the kidneys, the ureters, which are those tubes connecting the kidneys to the bladder, and the bladder itself all share the exact same internal mucosal lining, they are all vulnerable at the exact same time. So a tumor discovered in the bladder might just be the tip of the iceberg of a multi-organ invasion. The cancer can literally pop up in multiple, completely separate locations across this entire shared pathway all at once.
Section 3. Treatment and bladder removal. Once diagnosed, the depth of the tumor's invasion dictates a brutal fork in the road for the patient's treatment options. The stakes right here are incredibly high. If the cancer is superficial, meaning it hasn't reached the muscle yet, it can often be managed with a straightforward endoscopic procedure called turbit. A camera is inserted, and the tumor is quite literally just scraped away from the inside. It's highly curable. But the moment it hits that muscle tissue, the game completely changes. Partial removal simply isn't effective enough to guarantee the cancer won't come back. Once the muscle is invaded, the standard life-saving treatment is a radical cystectomy, which is the total removal of the entire bladder.
And because of that spatial multiplicity we talked about earlier, the surgery can actually be even more extensive. In severe cases where the cancer has appeared in multiple locations along that urinary tract, patients have had to undergo the traumatic removal of their bladder, their ureters, and even both kidneys all at the same time. When this happens, the patient is committed to lifelong dialysis because they just no longer have the organs to filter and process liquid waste.
Section 4. Life after total removal. If the entire bladder is removed, patients face a shocking surgical reality. They have to find a completely new way to store and expel urine.
To solve this, surgeons have to perform some pretty incredible, yet highly invasive, anatomical engineering. They actually harvest a portion of the patient's own intestines, which are about 6 meters long, so we have some to spare, to surgically construct entirely new urinary pathways. They might create an ileal conduit, routing urine to an external bag. Or they might fashion a neo-bladder, which is an entirely new internal pouch made of intestine that gets reconnected right to the urethra. Now, for high-risk or elderly patients who just can't endure a massive intestinal surgery, they might perform a cutaneous ureterostomy, connecting the ureters directly to the skin. Either way, these are massive, life-altering changes.
Section 5. Why early detection matters. But hey, let's pull back from the edge of fear for a second, because this entire narrative completely changes if you take immediate, proactive action.
Here is the single most empowering number in this entire explainer: 75%. 75% of patients who go to the doctor at the very first sign of trouble, like that painless blood in the urine, catch the cancer at the superficial pre-muscle stage. And at this stage, as we saw earlier, it is highly curable with that simple endoscopic scraping procedure. The difference between a simple curative procedure and losing your entire bladder literally comes down to acting immediately.
Now you might be thinking, is there a simple blood test for this? Well, reliable blood markers aren't widely effective or available for bladder cancer just yet, but standard urology clinics can easily run these 3 simple, completely non-invasive tests: urine cytology to look for microscopic cancer cells, an ultrasound to safely check the shape and lining of the bladder while it's full, and a standard urinalysis to check for invisible occult blood. It does not require a painful camera scope just to get an initial screening.
So, we arrive at the ultimate question. Knowing how fast this disease moves, knowing how aggressive it becomes once it hits the muscle, but also knowing how easily it can be cured if you catch it today. If you are a male, over 50, and especially if you smoke or have ever smoked, what are you waiting for? Isn't it time you finally scheduled that urology checkup? Don't let a silent symptom turn into a loud emergency. Get checked, stay ahead of it, and take control of your health.